So what I'm going to be talking about today is introducing you to the latest work we've done. This is the latest report that just came out recently in November, been introduced second half of November. And it's a project that brings together quite a lot of partners, lots of institutions, lots of organizations around the world. But this is the key message, and the message is this year we're focusing that ensuring that the health of a child born today is not defined by a changing climate. For those of you who are not familiar to the scene of health implications of climate change, this is the result. This is a scheme that was subsequently downgraded, but it's the scheme from 2015 report. Lancet journal commissioned the report in 2015 to look at the implications of climate change on health. And this is a characterization just in one plot of the complexity of the issue, the knock-on effects, the diffusion effects that are happening from climate change. So anything from the climate change leading to all the other issues that may be relevant, from undernutrition to mental health, cardiovascular disease, respiratory disease, harmful algae and vector-borne disease. But it's only some of them. The effects are much more complex. And this is how we started off on the journey. So 2015 report was the kickoff report by the Lancet. Lancet, if you don't know, is the oldest medical journal, professional medical journal in UK, and arguably the most influential medical journal in the world. It started off the commission in 2015 as a result, started off the report in 2015. As a result of the report, it set up a commission. And subsequently, we are producing reports every year that are there to track health implications of climate change along several dimensions that I will mention in a sec. And the idea is that we want to enable policymakers to tackle the issue of health implications of climate change by producing data, but also producing indicators that are tractable and that can speak to policymakers and relate to specific policy issues. So these are the partners. We have 35 organizations. We have 60-something academics from these organizations and 120 contributors. We cover every continent except for the Antarctica. And I guess quite a few UN organizations and universities, some of you probably from these organizations as well in this room. The key to the process is 5 working groups. We have the first working group that is really looking at the health implications of climate change. This is tracking from this wonderful chaotic scheme here, trying to see what are the key implications of climate change, identifying indicators that will allow us to track it over time, and focusing on these indicators, improving data, measurement models behind this, and doing this in a consistent manner, but also with a global coverage, because the key is not to focus on United States, Europe, or Australia. The key is to focus on all the countries in the world for as much coverage as we can get, but it's global. And then we have 2 subsequent groups that look at mitigation and adaptation, and then another 2 groups that look at bringing this all together under the governance framework, looking at economics, finance, and political environment for that. So from indicators that are tracking it to adaptation plans, mitigation plans, but also understanding what are the economic conditions for any of this to work, what are the governance political conditions for any of these grand ideas to work. So there are 41 indicators that we are tracking. As you can imagine, those working with data and real-world data, it's really difficult most of the time to identify good data and data that you're confident enough to show up, for example, to COP or to G8, G7 now, show up and talk to policymakers about these data points. So the confidence in the data, the quality of data, it's of paramount importance. So we have 41 indicators that we are tracking across these domains. And all of them relate to specific issues that tracking from health implications of climate change. There are three key messages that I would like to give you. I'll use this opportunity to convey three key messages from the latest report. So first of all, it's a personal thing, right? This child is actually, it's my daughter who was born in October this year. As a matter of fact, in the writing of the report this year, there were 6 children born during the process of the peer review with the Lancet and drafting. So within this process, this period, we had 6 children born for the team of the Lancet Countdown. And this is one of them, right? And just for the convenience of the setting, she is reading the book on artificial intelligence. It's illustrated, but she's young, right? So the life of every child born today will be profoundly affected by climate change. From the very beginning to the very end, every aspect of that life will be affected by climate change. And without accelerated intervention, the new era will come to define the health of people at every stage of their lives. There are 2 paths we can take. One is the business as usual, and this is continuing to do what we continue to do every day, like fly into Geneva airport and to participate in this conference and do all the things that are convenient. A second path, which limits the global average temperature rise well below 2 degrees, is possible. And it would transform the lives, the health of a child born today for the better, all the way through their life. And then this is an unprecedented challenge, and it will take combined work of 7.5 billion people to achieve that. A lot of work, but it is possible. And this is one of the key messages of the whole process that started from 2015, where the Lancet Countdown work is that this climate change emergency, the climate emergency, it is also, it has the huge risk of eliminating 50 years of progress on public health. But at the same time, it's a huge opportunity. We can do a lot, we can improve the health outcomes a lot, and we can work towards that. So this project is one step towards that. So with a first working group on the climate change impact, these are the indicators, specifically focusing on some of the things that we may think is a bit further out from everyday lives, and living in Europe or US in the developed countries, we may not appreciate how close a lot of these things are every day or in the really foreseeable future. One of the results we see is the return of the vector-borne disease. We can see the return of malaria. We can see the tick being spread, and also the related Lyme disease and everything else. So all of these things are potentially coming back quite quickly, much quicker than the health systems are prepared to deal with. Adaptation and mitigation, we have adaptation planning. We have lots of projects around the world in machine learning community as well, looking at the adaptation planning. And it's only a certain proportion of this adaptation planning that is taken into account the health implications. And this is one thing that we can learn and improve on. We also have the mitigation, and a lot of work done by ML community, AI community in climate change. A lot of this work is focusing on mitigation and improving some of the things that are happening. And this is great work that continue. But this is just one example about the mitigation. This is one of the indicators that we collected this year, is the contribution of the health sector itself. So if you think about the doctors as these great people who are supposed to help, health sector by itself, on average, is contributing 4.6% of carbon emissions annually. In UK, this is 5.4%. You can see US is contributing, US health sector is contributing by far the most, but you can see changes in some countries, dramatic increases in CO2 emissions from the health sectors around the world. These are the major countries. Decrease in some countries like Greece, but increase in other countries, dramatic increase. And there's a tremendous difference also. So India, for example, is 140 times less in CO2 emissions from the health sector compared to US. So this is just one thing, right? And reducing this, and this is where ML and AI and all the efforts being done, one of the efforts is the zero emission targets that are being produced in health sectors. So NHS UK, NHS England, just announced 2 days ago the setup of a task force that will aim to, using all kinds of existing technology, but also looking at AI potentially, make NHS with zero emissions by 2050. So there are lots of efforts being done around the world. Economic finance, this is another big area where you have the impact of health and climate change. And finally, this is the working group where that I'm involved. I will spend more time on the specific indicators to show you some of the work with the machine learning that we've done. So with this indicator, we're looking specifically at political and public engagement. How do we make politicians pay attention to the issue? How do we make them move this issue of health implications of climate change to the top of their agenda? So within the working group, we'll look at the media engagement, we'll look at individual engagement. How do individuals like you and me, how do we engage with the issue? It's a simple thing, but how many of you, for example, in this room with a raise of hands, how many of you thought about the link between health and climate change? Brilliant. So there are lots of people who are interested in the topic. But we want to trace this along the way, because if you think about the policy-making cycle, unless individuals are moving and the needle is moving on individuals on this issue, policymakers will never move. So it needs to be throughout this process. So we'll look at the individual engagement, and then we'll look at the high-level engagement. We'll also look at the corporate-level engagement, whether companies pay attention to this issue. Quick answer, no, not really. High-level engagement, this is one of the areas I will show you. So this is the individual level engagement first. Again, the challenge is to find data that will allow us to have a global coverage for the indicator, so lots of different countries, at the individual level, and trying to see the link between the health and climate change. So for this specific indicator, what we looked at Wikipedia, click-through data, and whether people, when they, for example, read a health-related article, whether they subsequently end up with a climate change article, or the other way around. And whether we can trace people moving in their reading patterns on Wikipedia. This is our greatest source of information these days, whether they move between health and climate change. So we can see the blue is health, red is climate change. Individuals on the individual level, they do read climate change. They're much more engaged with reading about health, but the relationship is quite tiny. There are only a couple linkages that are happening in the patterns of behavior of individuals. But at the high-level engagement, the next thing that we've done with the high-level engagement was to look at United Nations general debate. This is annual statements by country leaders in United Nations, and we wanted to trace whether they talk about the issue of climate change, whether they talk about the issue of health, and whether they talk about the connection. What we found is that in the run-up to the major events, there's a peak of interest. So in the run-up to 2009, so in the run-up to the big climate change conferences, to the big COPs and the signings of, so you have Copenhagen, you have Paris, in the run-up to those, you have some peak of interest. As soon as it's done, the interest disappears. The way that the policy-making process works is that unless it's on the agenda all the time, these peaks and troughs in policy interest and the policy attention, they will not help this challenge that we are facing. Most of the discussion in United Nations is driven by small island states, developing states. These are the countries that some of them are facing extinction as a country because of the climate change. So you can see why it's on the agenda, and they're driving the discussion a lot. So we looked at the data. This is some of the NLP, natural language processing application here. We looked at the general debate because it allows a big country and a small country speak about the same amount of time. So Donald Trump can speak about the same amount of time about the key issues that he is concerned about, the United States is concerned about, and also the former president of Kiribati. So a tiny nation facing extinction with rising oceans, they speak about the same amount of time, they have the same opportunity to talk about the globally important issues. One of the challenges of working with this is if you want to trace it over time, this is part of the NLP that nobody likes, natural language processing that nobody likes, is working with historical data, working with archival data that needs to be scanned, OCR'd, converted. It's usually graduate students and undergraduate students who suffer the most, but you still suffer through the whole process because it's just immeasurably complicated and painful to get this data clean. right? So using social media data is much nicer in that way. But you can see this example of George W. Bush statement, which was typed on a typewriter. It's recent. George W. Bush is within our living memory, but his statement was typed up on a typewriter. And this is a good example because sometimes you have the tape on the typewriters, you know those things where you type, right? So before the computers. So the tape, the ink tape, can wear out. So the page itself will be almost unreadable. And other times when the new tape is put in, you have it so thick that you cannot read anything because everything is blurring together. So you have two extremes, but tell it to an OCR engine that is trying to recognize. So Tesseract doesn't really know the difference between different tapes in the typewriter, right? So it's lots of painful work to create the data. So in the end, the data is there. We analyze the data from 2017 to 2018. All the data is publicly available. You can dig in if you like. And what we're looking at is trying to see why it's important. You might think that United Nations debates are not important. So just to counter this potential argument, we actually went and we interviewed people involved in those debates. And speaking to the people who actually draft the statements that country leaders deliver, this is the most sovereign issue that a country does. They show up and the country delivers. So they can coordinate on the votes in United Nations, but they never coordinate on the speeches themselves. You have the top level involvement on delivering the speech and drafting the speech itself. And it bubbles up from departments, ministries in different countries, all the way to the president or prime minister of the country where this is finalized. And it's supposed to reflect all the key issues that country cares about. So if we think that climate change and health is there, it will show up in the speech. We can see that it's showing up. So health is improving in terms of coverage. It's going up, pretty stably going up with a trend. Climate change, the green line is peaking, but its dramatic increase in climate change is the intersection of the two that we care about with the Lancet Project that is pretty much at the bottom there. So we can also understand what are the terms that are linked together. So looking at the different diseases that show up in speeches, different health outcomes that show up in speeches, we're trying to map them and see how they related to each other. And also talking to epidemiologists and health professionals, we develop a specific dictionary that we're trying to search through all those speeches. So it's anything from communicable to non-communicable diseases and health outcomes and linking it together to the climate change terms that are happening in the debates. So that's the coverage, and these are really just for the 2018 debate. This is the coverage. If you see the country on the map where you're representing, that you're from, some of them talk a lot about climate change, some of them talk a lot about health. But it's really a tiny proportion of the countries that talk about the intersection and the link between health and climate change. And most of these countries don't show up at this map because they're really tiny, small island states, either in the Pacific or in the Caribbean. And these countries are driving the debate about this really important issue. If you're interested, because you ML community, AI community, that all the data from all the working groups is publicly available. Feel free to dig in, uncover some of the other patterns. And this is just the repeat of the messages, because we use every opportunity when we talk about the Lancet Countdown project to repeat the message that it has clear impact on a child born today all throughout their lives. But we can do something. We can use this as an opportunity rather than thinking purely about the climate emergency as the emergency stuff. So there's an opportunity there as well. So thank you. And I will finish at that.
Thank you, Slava. Other questions?
I have a question regarding the healthcare impact itself, regarding the big gap between the United States and India. Do you know about the factors why it's so different? Like, it looks like US hospitals are run on diesel generators and India's hospitals are run by solar farms. What's the big gap, or what's causing this big gap?
So the biggest So first of all, it's the energy intensity of the hospitals will be different. Healthcare systems themselves, the energy intensity, think about this as energy intensity of the healthcare system. And it's different across different countries, obviously, for obvious reasons. The underlying model that goes, the measurement model for the data is the input-output model that is on the expenditure, health expenditure side. So it is picking up a lot of that, but also this is converted into the per capita. So it is still within that, it's the energy intensity that makes the biggest difference. It's anything from the buildings and also the medical equipment itself.
Can you then also comment on the decrease of the Russian Federation?
No, that's
the black line. No.
Black is Greece, so it's picking about here. And
I see. Okay, I see.
Yeah, so Russian Federation is pretty much it's up and down, so flat from before.
Okay. Thank you.
Let me move away from this slide. Everybody's going to ask questions.
No, but I just want to say with it. Do you know the numbers for Switzerland?
No, unfortunately not.
Okay.
So the numbers for, we, in addition to the global report, we do country reports, country briefings. And that's why I know the number for UK, 5.4 compared to 4.6 average. Germany was about 5.6, if I remember correctly, but I don't remember Switzerland, sorry.
Are you working together with the IPCC, with Working Group 2 specifically? They have One Health chapter. And then relate to that, Working Group 3, I mean, you already pointed out that mitigation actually has huge health benefits. It's a large scale picture. But the interesting thing is that from the IPCC side, this is not really actually analyzed at all, because the mitigation chapter doesn't go down the chain and the adaptation chapter just focuses on adaptation solutions. So there seems to be a gap from the IPCC side here, which, I mean, we just had a meeting yesterday where we tried to actually get to that, but there's so much to do that it's hardly doable in a certain way. And anyway, the big question is, how do you interact with the IPCC, and how do you, I think I see a lot of opportunities for joint work here.
I'm not gonna, I don't know about every level of interaction, but there's a huge overlap in terms of academics involved in the Countdown project and IPCC. And Christina Figueroa, she's on the oversight board for the Countdown. And that's a lot of overlap, including also during the COP, there's joint meetings at COP. Yeah.
Okay, let's thank Slava again.